Hello, YouTube. My name is Sapanta, and this topic came to me when I was scrolling on the 4chan fitness board, and there was a post talking about how steroids are gender-affirming drugs, and kind of made me think, why is it illegal for a man to take steroids to feel more masculine, but it's legal and even medically supported for someone to take estrogen and or hormone blockers to transition from male to female? They both involve changing hormones. They both involve trying to feel more like yourself. So why is one treated as a crime and the other as care? Now, this is a paradox that I want to unpack because the difference isn't really about the hormones themselves. It's about what counts as suffering, what counts as medicine, and who gets to decide which form of self-transformation is legitimate. Now let's start with something that most people overlook. For a lot of men, muscle isn't just about vanity. It's about meaning, it's control, and it's power. It's fighting a quiet, constant sense of inadequacy. The feeling that no matter how hard you try, you are never enough. For some men, that turns into a clinical condition called muscle dysphoria, a type of body dysmorphic disorder. Now, these guys, they look in the mirror and they see weakness when there's actually strength. They live in a body that doesn't feel like theirs. Now that's real suffering. But here's where the paradox begins. If a man says, I feel small, I hate my body, I need more muscles to feel like myself, the medical system says, we'll help you change how you think. But if someone says, I feel trapped in the wrong body, I need my body to match my gender identity, the system says, we'll help you change your body. Now, both are distressed. Both are alienated from themselves. But only one is treated with hormones. Now that raises a question. Why does one kind of body-based suffering count as medical and the other doesn't? Now the short answer to this is our medical frameworks. Now, gender dysphoria is officially recognized in the DSM-5 and the ICD-11. There's an established evidence-based treatment pathway for it. Psychological assessment in hormone therapy, endocrinological supervision. Studies consistently show that these treatments reduce depression, anxiety, and suicidality. In other words, gender-affirming hormones are backed by data. They improve lives. Now, muscle dysphoria, on the other hand, now this is recognized as a disorder, but has no approved medical treatment involving steroids. The recommended treatment is therapy, cognitive behavioral approaches, and sometimes antidepressants. And studies show that anabolic steroids usually make things worse, causing hormonal crashes, aggression, cardiovascular damage, and over time, higher mortality. So, from medicine standpoint, one form of hormone use is therapeutic, and the other is self-destructive. One relieves suffering, the other amplifies it. But that's not purely science. It's also about moral distinction about what kinds of suffering society takes seriously. The other difference is supervision. Now, gender-affirming therapy happens under medical oversight. Hormone levels are monitored, doses are adjusted, and side effects are managed. The goal is to bring the body into a healthy, stable hormonal range that matches the person's gender identity. Now, with anabolic steroids, it's usually the opposite. Most are underground, huge doses, unregulated compounds, zero medical monitoring. Now that's when you see heart attacks, liver damage, infertility, the list goes on. So when people say it's about safety, that's partly true. Hormone therapy is safer because it's controlled and clinically justified. But it's also about legitimacy. The exact same molecule, testosterone, can be seen as a life-saving in one context and criminal in another. It's not the hormone that changes, it's the story we attach to it. Legally, the difference is locked in. Anabolic steroids are classified as a controlled substance in many countries because of their potential for abuse in association with cheating in sports. Estrogen and hormone blockers, meanwhile, are prescription drugs, regulated but not criminalized, because their use is tied to a recognized medical need. And that mirrors society's moral landscape. Access to gender-affirming care is now recognized as a human right, a matter of personal dignity and autonomy, endorsed by the World Health Organization and the American Medical Association. But the pursuit of medical enhancement, muscle aesthetics, performance is still framed as vanity or deceit. The trans person is seen as reclaiming authenticity. The bodybuilder is faking it. That tells us the real issue isn't chemical, it's cultural. Now, should medicine only fix what's broken or help us become what we want to be? Traditionally, the answer, going all the way back to the ancient times, has been that medicine exists to heal, not enhance. Now, many philosophers, they argue that this line is blurry, maybe even artificial. If mental suffering comes from feeling trapped in a body that doesn't fit, whether that's because of gender identity or body image, why is one transformation valid but the other delusional? Now, this is where Mike Israetel comes in. Now, Mike Israetel is a sports scientist and a bodybuilder who represents the enhancement mindset. He talks openly about performance-enhancing drugs as a rational choice, a trade-off between health, achievement, and self-fulfillment. And to be fair, he treats it seriously. Informed consent, education, awareness of risk. In that sense, his position reflects personal autonomy. But here's where Mike Israetel's logic falters. He frames enhancement as optimization, as if the human body is just a system to perfect through discipline and biochemistry. But what that misses is that many of the men drawn to steroids aren't just chasing better performance, they're chasing worth. They're medicating self-hatred. They're suffering, not optimizing. And that's where the ethical tension lies. Because the boundary between therapy and enhancement isn't about molecules, it's about meaning. When someone takes hormone to live, then that's therapy. When someone takes them to escape themselves, that's something else entirely. Still, maybe that distinction isn't about biology at all. It's about which identity society validates. Trans identity has gained legitimacy through decades of activism and research. Now, muscle dysphoria hasn't. Now, one story fits our moral framework and the other doesn't. So in the end, the difference between steroids and gender-affirming hormones isn't really scientific, it's more philosophical. It's about who we see as broken, who we see as brave, and who we see as dangerous. Medicine, law, culture have built a framework that's internally consistent. Diagnosis, supervision, human rights, but still unethically even. Because maybe as our understanding of identity and suffering keeps evolving, the line between therapy and enhancement won't hold forever. Maybe the real question isn't whether someone deserves to alter their body, but how we can make sure they do it safely, with dignity, and without shame. Thank you.